All right, peace and blessings, and welcome, welcome, welcome. This is Brother Jabar, National Youth Commission Co-chair of NCOBRA, National Coalition of Blacks for Reparation in America. It's April 13th. We are a few days, 13, 15 days, depending on what state we're in, into our quarantine, stay at home advice from our president, from our governors. The coronavirus has really taken over the economy, taken over the airwaves, and the National Coalition of Blacks for Reparations in America is continuing to push forward on the efforts to get reparations for descendants of enslaved Africans in the United States. We are blessed to have our national co-chair on the line with us, Brother Kamm Howard. Want to welcome you.
Hey, peace, Brother Jabar. And man, giving much props out to the Youth Commission of NCOBRA, man, and for bringing us on this platform right now to speak to our youth at this very important time in our history in this country. Big props out to you, brother. Thank you.
Thank you for being with us, and I look forward to having a chance to dialogue at another time with your counterpart, Queen Mother Mashariki. NCOBRA is very unusual in a sense that it has all of its commissions or committees have a balance to it.
That's
that
right.
There's a male and a female, so there is no individual that's over the organization or over a committee.
Right.
It's always a male and a female. If you could just share a little bit about that structure that NCOBRA.
Yeah, it was very radical at the time when we created, when we started NCOBRA in the 1980s, the late 80s, 1987. That was a very radical concept to have male and female leadership. This was before, the gender, multi-gender and mixed gender status we have today. Back then, there was a big deal of sexism in the movement. And so to assure that was not in this new coalition that was being formed to win reparations, we created that dual leadership of male-female leadership to make sure that everyone's voice, gender voice, as we were recognized at that time, was being heard and being heard in an equal footing. So, the male co-chair voice was not louder than the female co-chair. The female co-chair's voice wasn't louder than the male co-chair, but there was this balance and harmony. And so, like I said, at that time, it was very radical to have leadership designed in that manner. And we're happy to continue in that fashion.
Brother Kamm, we met outside of the context of NCOBRA. Maybe it was about 2016 or something like that. We were in Dayton, Ohio. We were hosting, our organization, Racial Justice Now, was hosting a training, brought in Brother G2 Brown around education justice. And so we met then. You were a big proponent of the work of Dr. Amos Wilson. We had a great opportunity, you, me, and my wife, to dialogue about the organizing work that you had been doing and are continuing to do. So just let the people know a little bit about your background and what kind of work you've been doing to better our people in the community.
So primarily my work, outside of my employment, I'm a realtor, real estate investor, landlord. Landlords having difficult times right now with COVID. But outside of that, most of my activism has been in the realm of reparations. However, I also co-founded the Amos Wilson, Dr. Amos M. Wilson Book Club and Institute here in Chicago. Co-founded that with about 6 other brothers and sisters to study and test the power theories of Dr. Amos Wilson in the city of Chicago. And we see, Dr. Wilson's been gone now 20-some plus years, and we see that he was one of the most accurate scholar activists of our time, and certainly his teachings are definitely needed right now more than ever. So, just been in NCOBRA since 2000. I think it's 6. I joined in 2006, so 14 years into the coalition. I started in the local Chicago chapter. I attended my very first convention my first year of joining, and then I haven't missed a convention since. I moved up from just a member in Chicago to the Chicago chapter chair. I initiated several national initiatives as a member, as a general member of NCOBRA, and then I was subsequently appointed to as a board member at large. And then I was appointed by the co-chairs in 2008, 2009, when Barack Obama was elected president. The Senate was controlled by the Democrats. The House was controlled by the Democrats. We had a Democratic president, and John Conyers, who introduced H.R. 40, was then the Democratic leader of the Judiciary Committee. And so everything looked right for us for reparations at that time. And I was appointed to be NCOBRA's Legislative Commission chair to craft a strategy on how we would move H.R. 40 forward at that particular time. And then now I'm in my second term, my first year of my second term as National Male Co-Chair.
Excellent. I know we are, you're in the city of Chicago. I'm between Ohio and Maryland. We have, from my perspective, received some very strong civics lessons if we're paying attention, in that we're learning that governors, in a certain sense, I won't call them kings, but they have a strong ability to rule and to govern their state. I've also learned that through our civics lessons, that these are states, but to a degree, they're really independent nations. Right. And so share some of the things that you've done within the state of Chicago and Illinois.
So around the issue of reparations, we've done a lot of actions, what we call reparations enforcement actions in the city of Chicago, primarily against corporations. We did an action against Norfolk Southern Railroad. We had some success. We didn't get what we wanted, but we did force what a Chicago reporter said. We forced a string of concessions out of the railroad. But we didn't get the reparations, we didn't get the dollars that we wanted from the railroad, but there were some other things that they were forced to do. We went up against Rush University Medical College because of their history of robbing African graves during the apartheid era, so they can attract medical students to their school. We currently crafted, and we have in the city of Chicago City Council, a reparations commission bill that we're trying to push forward. Ironically, there was supposed to be a vote on it in the Health and Human Services Committee late last month, but it was postponed because of the COVID crisis. But we were supposed to have a vote in the Health and Human Services Committee in the Chicago City Council last month on that. And last month, we've also introduced a state reparations commission bill. Both of them are kind of patterned after H.R. 40, but we're certainly moving forward on the local and state level. Again, as you were just saying, states are independent in a sense. They have state rights, and the governor is the chief executive officer of the state, and he has a lot of power. She has a lot of power, aside from the federal powers federal dollars that come down into the state. The states really they do what they want to do. They make their own rules. They have to temper those rules according to federal dollars and how those federal dollars have to be used. But if there's no federal dollars involved, then they make up their own rules and make up their own laws. They have their own constitutions. So they are independent in a sense, but that's why you had the so-called United States of America, because they united under some circumstances that we don't have time to talk about, but they do have a large level of independence in regards to the rules that they make independently.
So tonight, what we wanted to really talk about, this coronavirus, where, again, it's April 13th. I'm in Maryland, and we've been under, a government order to, stay at home for the last 13 days, at least till the end of April. They've closed schools till the end of April, and they're closely watching the data. They're closely watching the amount of people that are being tested, the people that are coming in that are testing positive, those that are recovering, those that are not recovering, and that are dying or transitioning. And unfortunately, we've been seeing that many of those that are transitioning, that have their lives are ended from the coronavirus, are of African descent. And
That's
so
right.
we wanted to really give you an opportunity to kind of dig in and to share with the population. I know our expertise is reparations, but all these things are connected. So
They're definitely connected.
what's on your mind?
One of the things that we were having a discussion prior to, well, right around the time the coronavirus became a problem in Chicago, in America, was how do we prohibit what happened in 2001 from happening right now. And what happened in 2001, we had all of this momentum around reparations. And we had the World Conference Against Racism, where we came back with a major victory. And 2 days later, we were on the news, every local and national network was talking about reparations in 2000, in the late 90s and early 2000, in 2001. We were crafting legislation around slavery disclosure laws. We were moving forward, headed to a victory, and then that Trade Center Tower bombing happened, and the nation quickly turned to terrorism and national security. And reparations just dropped right off the table, not only among mainstream America, but even our own people. We stopped talking about reparations. We was on this anti-terrorist piece as well, and it took us 10, 12 years to rebound from that. So what we wanted to make sure that in this new American crisis, that the reparations conversation does not fall off the table, but in fact, it gets stronger. And we were kind of wondering whether or not our people will see us as being unpatriotic, is that we're focusing on reparations and the whole nation is going through a turmoil. But when the data came out that the majority of people who were dying of COVID-19 were Black people, and that it was the pre-existing illnesses that Black people have was the cause of their death, we saw this as a perfect opportunity to boldly interject the reparations conversation into this COVID crisis. And what I meant by that is that we understand, and I wrote a piece on this, and it's in the Chicago Crusader. The readers can go to ChicagoCrusader.com. And I wrote a piece entitled, "Transgenerational Epigenetic Injury is the Cause of the High Numbers of Death Among Black People from COVID-19. And basically what I wanted to say—
Hold on, I'm gonna need a TV timeout because those are some
okay,
big words right there now.
All right. Transgenerational epigenetics. So trans mean across. So something is happening across generations, from generation to generation to generation. Epigenetics is a new science that says that environmental conditions, cataclysmic environmental conditions, can alter the epigene component of the gene, a component of the gene. So epigenetics says these major cataclysmic environmental, because prior to that, they didn't think that environment had anything to do with gene expression. So this new field of study, they were trying to find out why grandchildren of Jewish Holocaust survivors have more lifestyle illnesses, heart attacks, strokes, diabetes, etc. The things that they say Black people have, these pre-existing illnesses. Why did these grandchildren of Holocaust survivors have more lifestyle diseases than their peers whose grandparents did not go through the Holocaust? And they found out that 6 years of Holocaust trauma affected their gene, and that gene was passed down 3 generations and can possibly be passed down more generations. We don't know because they're only testing the grandchildren, who are alive today, the grandchildren, so it's the 3rd generation. So we went through a 500-year Holocaust, not a 6-year Holocaust. So we know that our genes have been damaged. We don't know the extent, but we know our genes have been damaged. And just like the Jews who went through the Holocaust, we have a higher propensity of lifestyle diseases, heart attacks, strokes, diabetes, lung diseases, all of that. And having that higher propensity of these diseases, you bring in an infection, some type of virus, is going to automatically attack the people who have those illnesses. So it's not the pre-existing illnesses of hypertension, diabetes, etc. It's the pre-existing state of our genes that have been damaged that gives rise to those injuries that cause the death. And so it was enslavement. It was Jim Crow segregation. It's mass incarceration. It's police terror and police violence today that altered our gene that has us sick in all these different expressions of sicknesses. It was those crimes, those injuries that has us sick. And being sick, COVID has this free reign in our community. So you look at a city like St. Louis, 100% of the deaths of COVID-19 in St. Louis are Black. 80% of all the infected in Detroit are Black. 79% of the deaths in Milwaukee, Black. 74% of the deaths in Chicago, Black. 70% of the deaths in the entire state of Louisiana, Black. So it's the underlying illnesses that were caused by the crimes committed against our humanity that has us, we are born into a state of disease waiting to happen. And so the virus is just attacking that particular state that we exist in. I like to sum it up, brother, by saying, and I want my youth to really hear this, is that we do not, here today, we do not wear the scars of enslavement on our back. We don't have those whips, marks on our back, but we do have them on our DNA. We do have them on our genes. We are born with these whip marks on our genes, these scars on our genes, and we pass those down generationally. And so you see the high rates of juvenile diabetes, you see all the asthma in our community among our young people, and that's why the COVID virus is affecting the young, because they are expressing these illnesses at an earlier rate because of the factors, the high level of stress, the trauma, all that is impacting upon them, that have their genes being triggered much quicker than some of my people of my age who are older, who didn't go through that type of trauma and terror on a regular, constant basis as our youth are. And so we see this as a prime time to be bold, to be unapologetically talking about this issue of reparations, about repair, because it was the crimes committed against us that have us dying from COVID, and not just a pre-existing illness. And so I wanted to put that out there to our people so we can begin thinking and talking and discussing things from a different level.
So a lot of times we blame ourselves. Well, we just need to eat better, and we need to stop eating greasy foods, and so a lot of times we point to ourselves. I've seen those dialogues on social media and things like that. So what do you say to those people? Because sometimes we don't eat the best food, but sometimes we live in poverty. We live in the projects. We live in food deserts. There's these varying situations and circumstances that people say, well, we should just do better. But you're saying that it's being passed down biologically.
That's right, genetically, right. So not only does trauma, cataclysmic trauma, terror, like we've experienced in this country for 400 plus years, have the capability of actually injures or damages the gene, but also science has shown if you remove a people from their natural homeland, it could be from like the transatlantic slave trade, it can be from war, it can be from famine. You remove them from their homeland and you totally shift their diet. that will have a injurious effect on the epigene as well as the trauma, right? And so where do we get this diet from? All the fatty, greasy food, where do we get it from? We got it from enslavement. The primary diet among people of our ancestors' enslavement was cornmeal and fat. They gave our ancestors a chunk of what we call today salt pork, which is basically fat, looks like bacon, but it has very little meat in it, just all the white. And it fed them cornmeal. They got a chunk of that for the whole week. We learned to augment that poor diet by going into the forest, trying to get some herbs, by trying to plant whatever foods we could, steal a potato and start planting some potatoes from the master's garden, get what we could, and we also augmented it by the leftovers of the pig. We learned how to, we took the pig snout, the pig ears, the pig tails, the pig feet, the pig intestines, and we augmented that poor diet with this, what I call bad sources of protein, and in order to survive. So people call it a slave diet, but I call it a survival diet. Our ancestors did what they had to do to survive. And so coming out of enslavement, we began to eat more vegetables, but we still were stuck on so-called seasoning our food with this fat. We're still stuck on frying most of our meals. So we began to pass that down to today, where we're not eating any vegetables, we're just eating French fries and bad protein. That bad protein comes in the form of fried chicken, comes in the form of barbecue, comes in the form of fried fish and fried whatever, and potatoes is our basic staple in, like you say, these low-income areas. Where do we get it from? It's been passed down generationally, from enslavement. So the diet that we have is also reason to talk about reparations. It's killing us, but it was created from the crimes you committed. You took us away from our homeland. We knew how to had proper food combinations, protein, proper fats, proper carbohydrates, water, fresh water. I mean, we knew how to combine our food. We had herbs and minerals that our food was mineral dense, and you removed us from that. And so again, we come up today and we have this sick diet that triggers the gene damage. So it's not the diet, it's still the diet, and the social conditions in America triggers the gene damage that makes us sick. So whether you talk about diet or whether you talk about pre-existing illness, it still goes back to the gene damage from enslavement, from Jim Crow segregation, et cetera. And we want our people to be aware of that in this conversation. And one other thing on this, Dr. Fauci, as well as the Surgeon General, the brother Adams, they were quick to say COVID-19 does not have any genetic or biological cause. And they're right, that COVID-19, we're not dying from catching COVID-19 or dying from COVID-19 because we're inherent, because it's a Black thing. But the pre-existing illness is affecting us more, and that comes from the genetic damage. So it's not that COVID-19, it's not that COVID-19 has a genetic or a biological effect. It is the illnesses that has the biological effect, and then COVID-19 then runs rampant in our community because of the illnesses. So they're right in saying that, but they're wrong because they don't want to go back any further and look at why these illnesses persist. Why do the illnesses persist? Let's forget about, for a second, why COVID-19 exists. Why do the illnesses exist? That's the genetic, that's the biological component that they're leaving out of the discussion. And we want our youth, we want all of our people to be aware of it.
So where can we find that article? You said it's the Chicago Crusader?
ChicagoCrusader.com.
Excellent.
It's a major Chicago, Black paper in the state of Chicago. That's a major organ in our community, major institution in our community that allows for us to get this type of information out. I sent the article to the Chicago Tribune. I sent it to the Chicago Sun-Times and mainstream papers. and definitely they did not print it. Wasn't looking for them to print it. And but they also coming back and saying the same thing that Fauci and Surgeon General was saying, is that COVID-19 does not have a biological genetic cause, and we're in agreement with that. But the pre-existing illnesses has the biological and the genetic cause, and we're clear on that.
So it's April now, we're working up to June. Last year, we had a great convention in Detroit, Michigan. Had a great keynote speaker, an Honorable Minister Louis Farrakhan.
Yes,
we got our 31st convention coming up. It was due to be in Selma, Alabama, but things do change. As a people, we are always changing on the fly, adapting to wherever we can, just as you spoke about the diet. Share us with us quickly as we wrap this up about our upcoming convention.
Sure, our upcoming convention is going to be focused on, what the youth have to say about the whole reparations issue. We elders have been out here, most of us in the reparations movement got 20, 30, 40, some even got 50 years of activism in the movement, and certainly 20, 30 years in the reparations movement. And so we can get tunnel vision. And so to keep the movement fresh and new and alive, we want to focus on what the youth have to say about the issue and be mentors. Like the article that I put out, I want our youth to start thinking about this particular issue and take it to wherever they want to take it. And so we just want to share concepts with our youth, put some things on their mind, hear from them, and let's have this dialogue back and forth and see how we can move this forward in a faster way, because we're all locked in it together. So we haven't put together a program yet. We're still working on that. It's going to be heavily youth focused. Of course, we're not going to be in person. It's going to be web based, and it may be over several weeks, and not just, we're going to have at least 2 weeks, 2 days of programming, probably back to back in late June. But it'll probably still do something in September, October, etc., August, September, October, etc. Still web-based, because we can't have a full face-to-face convention. But we're going to have a lot of information out there, because this is a very important time. We're also going to focus on HR 40. HR 40, this is the furthest it's ever been in the 30 years in this it's been introduced since 1989. This is the furthest it's ever been. It has 125, I think 2 more co-sponsors, 127 co-sponsors. With 100 co-sponsors, we can go and we can call for a vote now in the Judiciary Committee. But and then once it votes out of the Judiciary Committee, it then goes to the House for a full vote. Congressman Sheila Jackson-Lee says we have enough votes to do that, but instead of doing it now, she wants to get 150 votes. She believes if we get 150 votes and take it to the floor at that time, we can get the other 68 votes necessary to pass it and make it become Senate to the Senate for them to have to debate on it. So that's what we're working on. We're going to focus on how to get those 150 votes, those other 23, 24 votes from congresspersons around the city. So whoever's listening to this, if your congressman hasn't signed on, you can still call right now during this COVID crisis and tell them to sign on. HR 40 is very important, especially since all of these legislators, senators, governors, representatives, mayors, aldermen, all of them are understanding, even by lip service, that there's a disproportionate impact on Black people from COVID. This is the opportune time to begin to call your congressperson and says, you see what's happening to Black people, this reparations commission is needed, and to sign on right away. So yeah, that's going to be our major focus at the convention, the youth, and how to push forward HR 40 and also local reparations like the Chicago Council Reparations Commission and the Illinois Reparations Commission and the Evanston Reparations Commission that our sister passed, Alderman Robin Ruth Simmons, first in the country. So we'll have that sister at our, will be highlighted at our convention as well.
Incredible. Brother Kamm, we appreciate your time. National Coalition of Blacks for Reparations in America, 30 plus years strong,
Yes, sir.
standing strong despite 9/11, despite the coronavirus, despite COVID-19, despite any and all things. We give you love and admiration for continuing to push forward to representing our people despite all of the challenges that we occur, knowing that there may be even more to come. So we look forward to hearing from you again. We look forward to talking to Queen Mother. This is Brother Jabar with the National Coalition of Blacks for Reparations in America, the Youth Commission Co-chair, and we are moving forward. We're not giving up. We continue to fight, and we thank you so much. And spread this to all your friends and family. Go see that article at the Chicago Crusader. And Brother Kamm, we look forward to dialoguing with you soon. Wishing you peace, brother.
Peace, brother, and thank you for your leadership, brother.
Absolutely. Peace.
Peace.